Hello, today we're going to be doing our presentation on Graves' disease. So let's begin. The case study. A 57-year-old woman comes into the hospital and presents with palpitations. Over the past 6 months, she's lost 10 pounds despite having normal food intake. She has also had an increase of irritability. Her thyroid is diffusely and symmetrically enlarged, twice its normal size, and it is also firm and tender. Lastly, the patient is presenting bulging of the eyes. She is recommended to an endocrinologist where they find her thyroid-stimulating hormone is low. Background and history. In the 1830s, Robert J. Graves was the first one to describe Graves' disease. He received his medical degree from the University of Dublin, where he contributed to the identification of hyperthyroidism by accident. He was given these 3 patients, all women, who had tachycardia and thyroid enlargement, and his colleague recommended him a 4th woman with severe exophthalmosis. Sorry for my mispronunciation. And that's how he was able to discover Graves' disease. And his findings were published in the London Medical and Surgical Journal. And some fun facts that I found about him is that he was proficient in German, which led him to an arrest in Austria as a spy because no Englishman could speak German as well as he did. Other than that, he was a really talented artist.
There are many symptoms that Graves' disease presents. The most common symptoms can include nervousness, fatigue, heat sensitivity, arrhythmia, and tachycardia, weight loss, a goiter, which is an enlargement of your thyroid gland found in 90% of patients under 50, and tremors. Some less common symptoms include dyspnea, which is where it's hard to breathe, and pruritus, which is an unpleasant sensation on the skin, which can cause itching. These 2 symptoms may result from the goiter. Other symptoms are vomiting, increased stool frequency, and muscle weakness. Rare symptoms include increased thirst, polyuria, which is large volumes of urine, loss of libido, spoon nails, which is nails that have lost their concave shape, exphilopomos, which is bulging of the eyes, oligomenorrhea, which is irregular menstrual periods, and muscle atrophy.
Graves' disease is the most common cause of hyperthyroidism around the world. It affects about 2 to 3% of the population and is also 60 to 80% the cause of hyperthyroidism. Graves' disease is mostly seen in people between the ages 40 and 60 years old, but can occur in younger people if thyroid disease is prevalent in their family history. Graves' disease is also more prevalent among women, where 3% of women and 0.5% of men will experience it in their lifetime, making women about 7 to 8 times more likely to have Graves' disease.
Some of the risk factors for Graves' disease include having a family history of the disease. This is one of the main known risk factors because many are still unknown. Women are 7 to 8 times more likely than men to develop this disease. This disease is most common in individuals aged between 30 and 60, but can occur much younger in those who may have a family history. Other autoimmune disorders such as type 1 diabetes or rheumatoid arthritis also have an increased risk in developing Graves' disease. Stressful life events or illness could act as a trigger for the early onset of Graves' disease among those who have the genes. Women who have recently had a baby have a 7 times higher risk of developing Graves' disease in the year after giving birth because pregnancy affects the thyroid gland. The last risk factor associated with Graves' disease is smoking. Smoking, specifically smoking cigarettes, can affect the immune system and cause the onset of Graves' disease and also face an increased risk of developing Graves' ophthalmopathy, which is a subset of Graves' disease associated with the eye, also known as thyroid eye disease.
Hello, I'm Isabel, and I'm going to talk to you about the physiology and pathophysiology of Graves' disease. Thus far, we've seen a little bit about the history of this disease and the symptoms that clue patients and doctors into its presence, but now I'm going to go a little bit more in depth as to why those symptoms occur. Essentially, what happens in the body to cause these symptoms? To do this, we need to look at the endocrine system, specifically the thyroid. The thyroid is a gland found in the neck. It synthesizes and secretes the hormones T3, T4, and calcitonin. The T3 and T4 hormones are of particular interest to us due to their roles in metabolic and cardiovascular processes. In fact, these hormones stimulate an increased metabolism in almost every tissue in the body, from the gastrointestinal tract, where they stimulate nutrient absorption, to the muscle and bone cells, where they promote cellular respiration and growth. They also increase heart rate and breathing rate. Simply put, this means that T3 and T4 influence how much energy your body uses, which in turn impacts your appetite, sleep patterns, and growth. So clearly, the thyroid has a very important job, and part of any job is knowing when to do it. This leads us into thyroid regulation, which is done by the hypothalamus. The hypothalamus monitors blood hormone levels to determine whether the thyroid should be producing hormones. If yes, the hypothalamus secretes thyroid-releasing hormone, or TRH, to the anterior pituitary gland, which then secretes thyroid-stimulating hormone, TSH, to the thyroid. Thyroid-stimulating hormone receptors on the thyroid receive this signal and prompt the thyroid to secrete T3, T4, and calcitonin. In a quote-unquote normal system, this is a negative feedback loop. As you've learned in class, when the hypothalamus detects that there are appropriate levels of T3 in the blood, it stops secreting TRH, which then prompts the pituitary gland to stop producing TSH. Without TSH, the thyroid stops secreting T3 and T4, so the body stops burning through energy so quickly. However, in Graves' disease, control is taken away from the hypothalamus. Graves' disease is an autoimmune disorder, meaning that the body essentially attacks itself. In this case, antibodies bind to the thyroid-stimulating hormone receptors in the thyroid, keeping them constantly activated and prompting the thyroid to produce T3 and T4 nonstop, regardless of the signaling from the hypothalamus. Interestingly, the excess antibodies are actually what causes the itchy skin and swollen eyes seen in Graves' disease. However, the unregulated T3 and T4 are what cause most of the other symptoms, like the noticeable goiter and the elevated heart rate and metabolism. In fact, the elevated metabolism is what causes the body to expend more energy than necessary, which in turn leads to a lot of the symptoms that you tend to characterize as symptoms of Graves' disease, such as weight loss, anxiety, tremors, fatigue, and difficulty staying warm. Luckily, there are ways to diagnose Graves' disease before many of these symptoms manifest.
In this slide, I will describe the diagnostic tests and imaging this patient would experience in order to be diagnosed with Graves' disease. As the patient goes into the hospital, the initial common procedure will include the patient taking a blood test, urine test, and her heart rate will be recorded. For a positive test for hypothyroidism, the blood work will show low levels of the thyroid-stimulating hormone and higher levels of thyroid hormones, as discussed in the pathophysiology slide. If the patient's heart rate is elevated and above the normal heart rate, it can also conclude the symptoms of Graves'. Another test that the patient might receive is a radioactive iodine uptake test. This is because the body needs iodine to make thyroid hormones. By giving the patient a small amount of iodine, results shown through a specialized scanning camera will give the doctor a measurable rate at which her thyroid takes up the iodine. The amount of radioactive iodine taken up by the thyroid gland will help determine if Graves' or another condition is the cause for the hypothyroidism. Furthermore, if the patient is ineligible to undergo the radioactive iodine uptake, possibly because she could be pregnant, the next step would include the use of ultrasound to determine if the thyroid gland is enlarged and would conclude the thyroid is swollen due to hyperthyroidism. Lastly, imaging tests such as CT scans or MRI would further conclude the diagnosis of an enlarged thyroid and or signs of ophthalmopathy. An enlarged thyroid is exhibited in the top photo where you can see an enlarged asymmetrical thyroid, whereas a normal thyroid would be depicted with a symmetrical butterfly shape. Also, in the bottom photo, it shows a scan with the bulging eyes, as the eyes will appear to be pushed out of the eye sockets. This slide will cover the possible treatments that this patient will have to undergo. I state possible treatments because Graves' can affect every patient on a different level. First on the slide, we have radioactive iodine therapy that would consist of the patient orally ingesting iodine into the thyroid cells with the radiation destroying the overreactive thyroid cells over an accumulation of time. As the thyroid loses cells, the goiter will eventually shrink. The goiter being the abnormal enlargement of the thyroid. This treatment is not for all patients because it can come with adverse side effects. Next, the doctor would prescribe antithyroid medications. The first choice medication used by endocrinologists would be methimazole with the brand name of Tapazole because it is safer on the liver. This pill is to be orally ingested and works by stopping the thyroid gland from making too much thyroid hormone. Beta blockers would also be prescribed to the patient for rapid relief of the symptoms pertaining to Graves. Beta blockers are not for the treatment of hormones, but works for the heart. For example, the commonly used beta blocker, propranolol, with the brand name Inderal, provides rapid relief of irregular heartbeats, tremors, anxiety, irritability, heat tolerance, sweating, diarrhea, and muscle weakness. Furthermore, if the thyroid can no longer resuscitate itself with therapy, surgery will be needed to remove all or just parts of the thyroid. However, surgical removal of the thyroid could come with risks. Therapy for the bulging eyes would also depend on how bad it is. If the patient's bulging eyes are not at an acute level to resolve themselves with lubricating tears or gels, then the doctor may recommend corticosteroids to lessen the swelling, or glasses, or Tepezza, a treatment pill for ophthalmopathy, or specialized orbital surgeries. Lastly, because Graves has a detrimental effect on the mental and physical health of the patient, lifestyle changes and home remedies will also assist in treating the dermopathy, which is the skin-related symptoms of hypothyroidism, the ophthalmopathy, and the anxiety/tremors. Home remedies would consist of protecting the eyes with cool compresses or wearing sunglasses, and the lifestyle changes may include a plant-based diet or removing toxic habits such as drinking alcohol and smoking.
Graves' disease cannot be cured but can be treated. Whether a person is treated for Graves' disease can determine Graves' disease's effect on their life and body. Without treatment, hyperthyroidism caused by Graves' disease can cause other health problems such as heart problems like irregular heartbeat. Graves' disease can also cause Graves' ophthalmopathy, which is an eye disease characterized by eye pain, light sensitivity, double vision, and even vision loss. Graves' disease can also cause osteoporosis. In extreme cases, these health problems can cause death in an individual. With treatment, hyperthyroidism caused by Graves' disease can be treated to return to normal thyroid levels, but most of the time, these normal levels are restored through medications like levothyroxine due to treatment causing hypothyroidism. Levothyroxine will also ultimately be something taken for the rest of the patient's life. Graves' disease also has a chance of reoccurrence if treatments like anti-thyroid drugs are stopped. Anti-thyroid drugs, if stopped, can cause about 50% reoccurrence of Graves' disease. But if treatment such as total thyroidectomy is performed, reoccurrence drops to 0%.
Other interesting information regarding Graves would be its association with psychiatric manifestations. With myself being a victim of hyperthyroidism, the anxiety and tremors that I suffered with was resolved by taking care of my mental health, by extracting all the toxic habits and anxious outbursts that influenced my bad mood swings and stress that I put onto my heart. Thyroid diseases were not apparent in my family lineage, therefore my endocrinologist and I believe the main cause for my Graves' disease was stress. This quote taken from a journal article states, Graves' hyperthyroidism may result in these latter manifestations via the induction of hyperactivity of the adrenergic nervous system. Because of this nervous system being hyperactive, this will cause abnormal mood swings and heart fluctuations, where beta blockers can be used. However, pills cannot be the only reliable source for treatment. Therefore, a patient can attempt to heal themselves mentally and spiritually by living more contently with their life and fabricating more self-love, as mentioned in lecture when we discussed mind-body medicine, and I believe mental healing plays a major role in treating Graves' disease and the associated heart problems. Thanks for listening.